Let's begin with the COVID numbers tonight. In just the past 24 hours, India has over 1 lakh more people who have tested positive for COVID. So early on in the third wave already. The last time we had over 1 lakh cases was at the peak of the second wave in June of 2021. If you compare these numbers to the previous day, cases are up 28.7% in a single day. Deaths, let's talk about that. 302 lives lost. 302 lives lost in just one day. The tests are also up slightly. They're 7.10%. Vaccination worryingly down by 5.3% over there. And the positivity rate at the moment at 7.74%. Let's look at the Omicron figures now and how they pan out. They have passed the 3,000 mark in the country. But again, to underline, this is just the tip of the iceberg, as very few samples actually go for genome sequencing and it takes a really long time. But maximum samples going from states like Maharashtra, from Delhi, from Karnataka and Kerala, where we are seeing these numbers go into 3 digits now. And as the cases go up, the third wave continues to rise. There are new rules for those flying into India. Starting Tuesday, that's the 11th of January, people flying in from abroad will need to home quarantine for a week and test on the 8th day. So home quarantine for 7 days and an RT-PCR test is what you will be required to take on the 8th day. If you test negative, you still have to self-monitor for the next 7 days. If positive, you will be expected to follow the new treatment protocol that has been recently released by the Health Ministry. And also, you have to now send your samples for genome sequencing. Also, remember, you will have to upload all your details to the Air Suvidha portal that has been made mandatory for everybody flying into the country. Apart from that, another change has been in the number of at-risk countries that have gone up to 19 now. 9 more countries added to that list. The entire list on your screen right now. Mostly it's the African countries which have been added. Interestingly, Singapore, which was part of that at-risk nation, has been removed from that list. Meher Pandey joins us now for the very latest on the overall changes that are taking place now. Meher, interestingly, home isolation has been made mandatory for 7 days for all international passengers. The key question here, however, remains how exactly is the government going to monitor home quarantine at a time when they only have to upload their details on the app?
Exactly, Sonal. So these are new strict regulations for people flying into India from abroad. Every single passenger from abroad will now have to home quarantine for a week, and on the 8th day of their quarantine, take another RT-PCR test and upload it to the Air Suvidha portal. If it is negative, then they have to self-monitor their health for a week, and if it is positive, they will have to go on with their treatment protocol. Now, for people who are coming from at-risk nations, the rules have not changed much. They still have to get tested at the airport mandatory. If they are positive, they are taken to isolation center. If they are negative, again they will enter home quarantine for a week and upload their test on the Air Suvidha portal. But very interestingly, it's the timing of these regulations that is being questioned already. Many are saying that 2 weeks ago, 3 weeks ago, this may actually have slowed down the spread of the Omicron variant, which, as we know, was arriving from foreign countries through people who were flying in. 2 weeks ago, this may actually have been helpful, but now many are asking, what is the point? Because already the Omicron variant is spreading like wildfire. Delhi and Mumbai have already said that it makes up the vast majority of cases,
right.
Over 80% in both places. And
in urban centers, at least we've seen clear.
Remember, because
in urban centers we've seen clear indications that Omicron is a dominant strain now, and we're getting more and more data into how it actually evolves in the rest of the country as well. And but now these measures coming in, welcome measured, but is it too late already? Is the point. Thanks so much for joining us, Meher. With that, talking about those numbers in urban centers, let's look at those in Mumbai. 20,971 cases have come up in Mumbai. That's about 800 more than yesterday. But it's a number of hospitalization which really needs to catch more attention now. Over 1,300 people admitted in hospital. 88 of those required oxygen support, and 6 deaths have come up in Mumbai alone in the past 24 hours. That was overall Mumbai, but let's look at Asia's largest urban slum in Dharavi. Cases have jumped up by a whopping 2,100% or 21 times in just 10 days. The BMC is taking all measures to activate sort of all quarantine centres and hospital beds at its disposal. All private hospitals have been asked to return to peak capacity as well by Tuesday, and 150 fresh cases have been reported today as well.
As COVID cases continue to rise sharply, with the state and the city reporting huge numbers, that impact is being felt in Dharavi as well. Now, Dharavi has a unique problem. Small houses, tenements, where isolation is practically impossible if someone tests positive. So that means that a more number of people have to be institutionally quarantined and perhaps also be sent to the medical facilities available. In the congested lanes of Dharavi, the virus is racing, up by over 2,100% in just around 10 days. Officials outline the challenges.
On 27 December, there were only 27 active cases in Dharavi. Currently, there are more than 450 active cases in Dharavi. Now, the challenge is to isolate them, because, see, there is no question of home isolation, because 80% of people in Dharavi stays in, depends on community toilet, which is being used by several people, and there are hardly 450 community toilets in entire Dharavi.
Mumbai civic body has already asked private hospitals to augment bed capacity to peak levels, which means the maximum number of hospital beds will be available in the city. The BMC commissioner, who had told NDTV that more restrictions would kick in if daily cases crossed 20,000, ordered private hospitals to restore bed capacity to peak levels as it was on 5th May 2021. Private hospitals have also been asked to ensure that there are no direct admissions without intimating ward war rooms. 80% of total COVID-19 beds and 100% COVID ICU beds at private hospitals will be reserved for ward war rooms to allot to COVID patients.
During the wave 2 of COVID, we created close to 160 beds. Out of that, close to 90 beds were there in one of the facilities, and that is active. And we are in the process of opening up one external center where close to 65 patients can be accommodated. We had a center along with the BMC where we planned for high dependency bed around 20 numbers. So if needed, we'll activate those beds also. But at this juncture, it becomes very important for us to keep our human resources like doctors, nurses safe and secured.
From 27 to nearly 600 in just around 10 days. That's how fast the virus is spreading in Dharavi, Mumbai's most congested slum. But with infections less severe and less hospitalizations, the situation is under control. But as cases rise, the demand for quarantine centers will increase, and that officials say is going to be a challenge in the third wave. In Mumbai, with camera person Ashok Mahadik, Saurabh Gupta, NDTV.
Supreme Court today gave a major relief to doctors, allowing commencement of the NEET PG counselling. Admissions will now be based on reservation of 27% for OBC and 10% for the EWS category. Now, this judgment actively brings an end to a delay in the admission process of the PG medical courses for hundreds of junior doctors, a delay that has put a great deal of pressure on the existing workforce of resident doctors, already sort of reeling under the impact of the third wave.
Discuss about that, please. Yes,
a major respite for over 45,000 doctors burdened with COVID care. With the top court allowing the commencement of counselling process for admissions in medical postgraduate courses. Thousands of doctors have been protesting, asking for the commencement of counselling. According to Supreme Court order, the Supreme Court allowed 27% reservation for other backward classes and 10% quota for students from poor families. For economically weaker category, existing criteria of 8 lakh a year income limit has been upheld for this academic year. Top Court will hear the petition regarding the validity of EWS criteria in March. Healthcare workers have expressed relief after orders of Supreme Court.
Since day one, we have been demanding that the NEET PG counselling should happen as soon as possible. Our doctors are also coming positive day by day, and as a result of which, are continuously falling short of manpower. So it's a big sign of relief, and with thanks to Supreme Court.
Centre on 29 July 2019 brought a reservation of 27% for OBC and 10% for EWS category in medical dental admissions. 8 lakh income criteria fixed by the Centre for determining EWS category. Several petitions were filed in Supreme Court against the decision of Centre. Supreme Court on 7th October questioned 8 lakh income criteria for EWS category. Centre on 30th November formed a committee to review the EWS criteria while putting counselling for new admissions on hold. With continuous delays in fresh admissions during COVID-19, doctors started protests across the country, following which Centre urged the Supreme Court to allow admissions based on existing rules. The Supreme Court, while allowing the commencement of counselling for NEET postgraduate and undergraduate courses, called this a matter of national importance. This order by the Supreme Court is coming at a time when the entire country is already facing a dearth of healthcare workers amid a rising third wave. And this order by the Supreme Court is expected to provide a major respite to the healthcare services across the country, with about 45,000 doctors expected to join the workforce soon. With correspondent Ashish Bhargav and camera person Pawan Tiwari, I'm Akshay Dongre for NDTV.
And this judgment is even more relevant in these times as cluster after cluster of doctors is testing positive. First in Punjab, then Delhi, then Mumbai, and now news of over 50 doctors in a Chennai hospital testing positive is also a cause of concern. While COVID beds are not filling up at the same pace as the first or the second wave, in fact, it's the non-COVID patients and surgeries which perhaps will take a hit.
Over 50 doctors and health workers at 3 key government medical college COVID hospitals in Chennai have tested positive for COVID. At this Stanley Medical College in North Chennai, 30 students who had gone on a trip have returned positive. In the same campus, 2 postgraduate doctors and 14 others, including 7 nurses, are down with COVID.
Many students tested positive and they are isolated and they are treated in hospital.
They are doing fine?
Yeah, and contacts are isolated and they are also tested as repeatedly tested, and if they tested positive they are also isolated.
At the Kilpauk Medical College Hospital in the heart of the city, around a dozen doctors have contracted the virus over the last 1 week. It all began a few weeks ago when around 50 doctors and health workers at this Rajiv Gandhi Government Medical College Hospital had got COVID.
Most importantly and worrisome for us was that in GH, when a diabetic patient for his foot ulcer was being operated, his test result turned out to be S-gene dropped. 7 CRRI students, 7 nursing students, 3 nurses and workers and all became positive, out of which 42 were S-gene drop.
The health department says all the doctors and health workers are stable and under observation. It denies the spread of the virus among its foes has impacted treatment of patients. Hospitals have tightened their SOPs. In May, Chennai had peaked with 7,500 cases. With the city projected to touch 3 times high, there's an urgent need to protect doctors and health workers from the surge. In Chennai with Suresh, Sam Daniel, for NDTV.
Let's look at the global numbers now in COVID cases and how they pan out. At the moment, in United States, the cases are over 7,87,000. The deaths are over 1,800. In France, that's number 2 position, 2,61,000. Deaths are 204. These are daily figures. Remember, United Kingdom is 1,81,000. 232 deaths over there, followed by India at number 4, over a lakh and 17,302 deaths. And then followed by Turkey, which is 67,400 plus cases and 150 plus deaths. If you see that, the number of deaths maximum in countries which have seen more unvaccinated people as well. All right, switching tracks to back home now, where 2 days after the major security breach left Prime Minister Modi stuck on the Punjab highway for 20 minutes, a fresh video has emerged that shows a group of men carrying BJP flag, shouting slogans like BJP Zindabad, standing dangerously close to Prime Minister's car. Now, many now saying it was then the BJP workers understood to be heading to the same rally as the Prime Minister, and they were also stuck on the same highway. This has come at a time when the farmers are saying, well, it wasn't us, but the BJP workers who were a threat to PM security. In middle of all these new twists and turns that are emerging out of these new videos, NDTV had an exclusive chat with the Punjab Chief Minister, who believes that this security row is just an excuse for the centre to try and impose President's rule in poll-bound Punjab.
A 3-member committee constituted by Union Home Ministry visiting the spot in Firozpur, the exact place where on the 5th of January the Prime Minister's convoy was stuck. The team summoned the State Police Chief S. Chattopadhyay and 13 other senior police officials to Firozpur to find answers to the most important question: who is responsible? Later, Ministry of Home Affairs also issued a show-cause notice to the Bhatinda Senior Superintendent of Police, telling him to reply within a day. Later in the day, some new videos surfacing showing the Prime Minister's car with BJP supporters meters away from the motorcade, not the protesting farmers. The matter also came up in the Supreme Court, with the top court directing the Registrar General of the Punjab and Haryana High Court to forthwith seize and secure records of the security measures for Prime Minister's visit to Punjab on the 5th of January. A bench led by Chief Justice of India N.V. Ramana orally asked Punjab and the centre to meanwhile put on hold the inquiries of its respective committees till Monday, the next date of hearing. Meanwhile, the political slugfest continued between the centre and the state government. Congress's Punjab Chief Navjot Singh Sidhu saying this is an attack and insult on Punjab and Punjabiyat.
कि 70,000 कुर्सियों पे 500 बंदों को हिंदुस्तान का प्रधानमंत्री एड्रेस करे, जब कोई ऐसा प्लान ही नहीं था कि वो सड़क से जाएंगे, तो यकायक ये प्लान कैसे बदला? और अगर बदला तो ये बहुत साफ है कि वो इस ह्यूमिलिएशन से बचना चाहते थे कि जो बीजेपी का कंप्लीट फेलियर, दे वर लाइक अ बस्ट बलून, इस बात को अवॉइड करने के लिए उन्होंने ये बहाना रचा है।
ऐसा है। In an exclusive interview to NDTV, Chief Minister Charanjit Singh Channi said the real intention of the centre is to impose President's rule in the state.
आपको डर है इस बात का कि इसी बहाने राष्ट्रपति शासन?
अरे डर नहीं है, इन लोगों की सोच है, इन लोगों की ये सोच है कि यहाँ अराजकता फैलाएं, यहाँ लोगों को डराकर वोटें लें। पंजाब डरने वाली स्टेट नहीं है।
The Congress's response today in reply to the BJP's nationwide protests like this one. MPs of the party sitting near the Gandhi statue in Parliament and Central Minister's scathing attack on the Congress's interim president, Sonia Gandhi.
I would like to tell the Congress establishment. Modi became the Prime Minister of India with the blessings of the people of India. Narendra Modi went to Punjab today to dedicate projects worth 42,000 crores for the people of Punjab. When you can't answer on issues of development, this is the depths to which you will fall.
Even 2 days after the incident on January 5th, the state police chief has not come out with a detailed statement to ascertain and identify that what exactly happened, which led to the Prime Minister's convoy to return without addressing a rally in Firozpur district. And this has only led to a bitter blame game between the centre and the state government. In Chandigarh, Mohammad Ghazali for NDTV.
The government advance estimates have just been released this evening, and that talks about the financial year 2022 growth, all set to surpass the pre-pandemic GDP. A growth of 9.2% has been projected versus minus 7.3% in the year 2021. It is said to be supported by uptick in farm, mining, manufacturing outputs, and RBI has given these numbers with the rider that no resurgence of COVID takes place in India. Interesting to see that come up right in the middle when India is in midst of a third wave. Manufacturing also seen a growth over there, 12.5 against 7.2% the previous year. Agriculture sector also growing than the previous year. Mining as well. Trade, hotels, transport expected to grow. And this is the major one, 11.9% versus 18.2% in the previous year. And finally, we've known this for a while, but now the Indian Tele Awards also acknowledging the DOT, the Essence of India campaign, as the most iconic television campaign of all times. Also, our campaign Zuba Pe Sach, Dil Mein India, Sach Dikhate Hain Hum, has also won the most iconic television campaign of all times. The best brand collaboration with news channel Editor's Choice has gone to the Luminous and NDTV campaign. Diya Bijli Dona, and the best collaboration with news channel also gone to NDTV Dettol Banega Swasth India campaign, which is now running in its 7th season.